Hello all, good morning. Welcome to our program webinar today, and that we are bringing exclusively to our Citrix Ready partners. I am Sagnik Datta and I will be your host for today's webinar. I work for the Citrix Ready as the technical marketing specialist and manage the desktop ecosystem. I'm also responsible for the vertical program initiative that we are launching today for our partners, including the planning and the execution. So I look forward to working with many of you. And along with me, I have Yuting Huang. She's the Director of Integrated Product Marketing and our expert in financial services industry. I have Nitin Sharma. He is the Solutions Marketing Manager and our expert in healthcare IT. And I have Corinne, who is the Education Vertical Solutions Marketing Director. Agenda, so we have a lot of ground to cover today, but if I have to leave three things with you today is A, industry knowledge in the targeted vertical, B, how Citrix plays in each of these industries, and C, and how you as a partner can leverage some of the benefits that we are providing and jump on the bandwagon and build solutions or marketing opportunities that continues to be part of our shared success. Citrix Ready, so very quickly now, this is a platform that showcases products. We are all of us are familiar with this. That's our niche. Partners verify the products using our many toolkits, and once verified, we showcase your product in our marketplace with the set compatibility version. So why talk about solutions, right? So I will draw a quick analogy here, and that's my favorite car. I'm sure everybody has seen a Tesla. And Tesla is certainly one of the pioneers in disrupting the traditional and automotive design and distribution model. So as a consumer, let's say you want to buy electric car and you choose Tesla, a product that solves this need. But then you handle your other needs separately, such as, let's say, increased electricity bills and higher dependency on renewable energy. So ultimately to that, you buy a solution. You buy a Tesla along with a Tesla-powered home, installing solar roofs that replaces your old roof tiles with solar tiles, and that converts solar energy into electricity for your home. A well-integrated solution with your Tesla home batteries as well. Integrated future, right? And that's the key here. Although the two solutions, the two products, the Tesla and the Tesla-powered home, are individual separate products, it has been presented as a beautiful, affordable, and seamlessly integrated product that becomes a solution. So while we talk about solutions, why verticals in the first place? So I wanted to preface the conversation as to why verticals. For one, customer expect vertical expertise. We get to hear that from our sales, and verticals being the front and center in reaching new markets and penetrating the existing. Citrix is already positioned to meet the more mobility and the security needs of our customers, and we have a strong leadership focus in verticals in our organization, and you'll be hearing from some of those speakers today. Also, the conversations are shifting to focus now, as I touched upon in the previous slide, and this leads to more strategic engagement. And as we see competition arise, there is an increased need to be differentiated. Focusing on vertical addresses that, and finally, vertical programs are proven to perform. So without further ado, this is the introductory slide that calls out our main objectives of this program, and that is to build and promote a library of white papers. We want your story to be out there that portrays the best integrated joint solutions in context to an industry. So I'll be passing on the presentation on each of the vertical owners here to walk you through their industry of expertise, the marketing opportunities, the trends, the use cases, and the customer personas who are involved in decision making in general. And while they do that, I would encourage you as a partner to place the use cases that we talk about in context to your products as applications, as applicable. So a couple of the housekeeping items for Q&A. Please use the question panel on your right. We will attempt to respond them on chat and or at the end of the presentation.
My name is Nitin Sharma. I'm one of the Solutions Marketing Managers here at Citrix, part of the Healthcare Solutions Group. So I wanted to go through a similar format to what UTIG did to cover some of the key trends that are going on in healthcare. What are some of the customers are thinking about, the opportunity within the space, as well as some of the key areas that Citrix is addressing those challenges in healthcare, and how Citrix Ready partners can fill some of the gaps that that can kind of fully complete the picture and resolve some of the problems that healthcare is facing. So first, I wanted to touch on some of the key market drivers, really from a high-level perspective. So right now, the key thing is, for the past 10 years, or actually a couple decades, reform is one of the biggest drivers, and it touches on a lot of the other things and trickles down to some of the other initiatives you're seeing on the slides. So some of the mandates are like meaningful use, the various stages that healthcare providers are trying to attest to get funding. The High Tech Act was also something that was passed a few years ago, or several years ago, to basically mandate healthcare providers or enabling technology to, in the sort of present day digital age, and making patient records a little bit more easily accessible, giving the power to patients to have the ability to address their own healthcare, but also making sure that there's also a very good healthcare providers are actually being more secure. That leads into, with all the recent reform and mandates, IT organizations or healthcare organizations had to shift their strategy. They want to be more agile, so this basically means that they need to basically be more efficient within their organization without increasing costs. A lot of healthcare providers work on slim budgets, so that they're trying to take the most tactical approach when it comes to basically growing your organization without increasing spend. That leads into efficiency. There's a lot of IT consolidation and simplification, but also efficiency from a patient care perspective. They want to reduce readmission rates, unnecessary care, or redundant care, because in this present day environment, or healthcare organizations can be fined for having a patient come in for the same issue multiple times. So a lot of that also bubbles into, with the digitization of healthcare, leads into security. There's a lot of compliance mandates and security and compliance audits that take place in the industry. There's a lot of HIPAA data breaches, and they need to also be PCI compliant, because a lot of transactional data from credit cards gets involved in the healthcare space. From a workforce perspective, IT is used as an acquisition strategy for a lot of top-tier talent. If you're a healthcare provider that's providing the latest tools that doctors need and require to provide better care with the latest cutting-edge technology, you're going to get a little bit. You're going to be seen as a go-to hospital versus one that's still a few years behind on the technology curve. And also that leads into the bread and butter of the healthcare industry, is basically ensuring that the patients are getting the best care that they can, and health organizations are giving them the tools and technology to take care of their own, to seek care a little bit efficiently. So that's usually like telemedicine, being able to access your medical records on the fly, being aware of what are some of the things that you can do as a patient that can improve your own lifestyle, and the healthcare organizations are playing a part of that. So going into some of the key data points in healthcare, from a Citrix perspective, we're seeing tremendous growth globally in the healthcare IT landscape. Clinical applications are expected to grow 20%, as you see, through 2020. And we see that reflected in Citrix success. So if any of the folks that are on the phone have seen any of the press releases from David Henshaw or Krill, they'll, on the quarterly earnings call, they're always talking about the most, probably a dozen $1 million Citrix deals every quarter that are in healthcare. So that gives a lot of opportunities for our Citrix Ready partners to work alongside with to ensure that we're filling all the gaps in the technology strategies for these healthcare providers. There's still a lot of great white space and mid-market opportunity that we're seeing. This is an own Citrix analysis, but we see a $1.5 billion opportunity worldwide of customers that aren't currently using Citrix or leveraging Citrix. So we can partner with Citrix Ready partners to see how we can better penetrate within these specific areas. As you see through Americas, the Asia, APAC area, as well as Europe and Middle East. So just from where Citrix is today in healthcare, worldwide we cover over 4 million caregivers. Over 4 million caregivers use Citrix every day. 100% of the top 10 largest U.S. healthcare organizations are dependent on Citrix. We cover over 88% of Epic Hyperspace installs worldwide. And over 250,000 concurrent users on Cerner are 250,000 users are accessing Cerner via Citrix. And healthcare providers choose Citrix because it's one of the more complete end-to-end solutions that offer the ability to access the core clinical applications, as well as enabling their mobility strategy, and also allowing them to create security layers to prevent and mitigate data breaches. This slide is just to give a good snapshot on some of the key names that are in healthcare that are using Citrix in the U.S. So I want to touch on some of the key use cases that are in healthcare that we're seeing, and we've just kind of categorized them. I've kind of categorized them on the app delivery or mobility slide, and then I'll transition over to some on how this plays out with some of the initiatives in healthcare. So in app delivery, the biggest thing that healthcare providers are concerned with is how do they ensure that their doctors are able to access their EMR and EHR. So EMR and EHR deployments are still very, very key in access in healthcare. So they want to be able to provide their clinicians and staff with access to medical records on various devices and make sure the transition is seamless. Typically, these types of software are very, very resource intensive, but when they can be deployed out from the data center, they can be accessed on pretty much any device, whether that's a low-cost thin client or a tablet that's like an iPad or an Android device. Secure affiliate access. This is access to third-party vendors or any kind of additional staff outside of the four walls of the hospital. M&A and IT consolidation is very key. As I was mentioning earlier, a lot of these healthcare organizations are trying to get a bigger population pool, so they're trying to expand out to new geographic areas, and they're doing this by merging with smaller community hospitals. So these large health systems are trying to become a one-stop shop and cover sort of a large swath. A good example of this would be Cleveland Clinic. It operates in multiple geographic areas throughout the United States, and they usually do that by, instead of building out new facilities, they just acquire a smaller community hospital that ends up becoming under the Cleveland Clinic umbrella. And outside of the clinical side of it, actually, let me touch on the other thing is the big opportunity for us, as well as key Citrix Ready partners that offer endpoint solutions or mobile workstations and endpoint devices and thin clients. Hospitals are still looking at going through thin client rollouts and replacing old, outdated fat clients or computer systems, whether that's on the hospital floor or on the staff side, the non-medical side of the hospital organization. And that's where I go into the non-EHR EMR apps. So an opportunity for health systems, an opportunity for any IT organization to sell into a healthcare provider to provide them a full end-to-end solution, wall-to-wall. Hospitals are run like a business. There is a marketing side, there's a finance side, and there's an accounting, there's an HR side. So a lot of those guys need that staff also needs, seamless access to core, clinical apps. EHR as a service and EHR replacement, we're still a little bit of, not so much. Typically, this was something that we saw a lot of last year. Hospitals migrating from one EMR to a more predominant EMR, EHR, just based off needs or necessity or user experience. And then we go on the mobility side. So this is more, mobile means more than just mobile devices. We're talking about now allowing a clinician to become mobile, giving them the access to core clinical patient data outside of the four walls of the hospital, and make sure it's security and secure. So meeting data governance and compliance mandates, and then the actual clinician mobility. So these are mobile device initiatives, allowing doctors to roam around and do their rounds on tablets, have face-to-face engagements with a patient and their family at the patient's bedside, and showing them medical records on a tablet device that they can access an EMR, EHR app without having to relaunch the application. It just sort of picks up their session from a previously launched terminal. And mobile application, that leads into ensuring how you ensure the mobile device and the application itself. So you can kind of categorize a lot of what the use cases under main initiatives. You have security initiatives, you have clinician mobility, and then you have the IT flexibility. So before we get into that, so the reason Citrix healthcare providers are picking Citrix is basically we're helping them address those three initiatives. We're allowing them to improve clinician access, workflow, and experience. We're enabling staff mobility on any device, and we're actually making IT more agile and flexible while enhancing security and compliance. So security and compliance, these are addressing regulations and risks and cyber threats like ransomware. Data breaches are still the #1 concern of CIOs globally. There's a data point from the Experian 2017 data breach industry forecast that says healthcare organizations will be the most targeted sector with new sophisticated attacks. So in this industry, data encryption is essential to meet multiple compliance and government mandates. It's about providing network security, access, and control. You see, the reason being is because the average cost of a medical record stolen is $363. The average cost of a breach at a healthcare organization is $4 million, and collectively across the industry, the annual cost of data breaches impact the healthcare organizations, costing them about $6.2 billion. Citrix's role in security and compliance, we allow control access by user, device, or network. We restrict actions like print, save, cut, paste. We allow auditing, like IT to audit end user sort of activity and record user activities via technologies within the suite, like session recording. This allows for like detailed activity logging for compliance audits. We also do multi-factor authentication with NetScaler from the app and desktop, basically creating granular policy controls. So from a Citrix Ready opportunity, we partner with a lot of vendors that allow an additional layer of security, but also enhance end-user experience. So a good example of this would be, like authentication or SSO type badges, where you remove the action of an end user or a doctor having to type in his credentials. You can allow them to launch right into his workstation with a tap in, tap out badge or proximity badge that houses his Active Directory credentials. So there's no risk if there's any sort of keyboard type loggers that are on the device or on the actual terminal or doctors. You reduce also the ability that end users have to call for password resets because it's all stored on when it's actually just authenticated through a badge in or badge out. So going into the sort of the clinician mobility initiative, clinicians, they demand access to patient records on their mobile devices. You know, healthcare organizations compete with each other in some parts of the world for prestige and talent. So allowing doctors to be able to work remotely or being able to take advantage of all they can for their daily rounds, instead of having to do a lot of admin tasks and paperwork outside of their workday, that becomes a recruiting tool and something that healthcare organizations leverage. So, this basically is, follow me desktop roaming, being able to launch, look at a patient record from the office or a mobile card and smooth roaming over to an actual iPad or tablet device. And as I was mentioning earlier, being able to face-to-face engage with the patient family or patient, and being able to also update a patient record on the fly. So as you notice, if most people are familiar, back in the days before sort of the digital transformation in healthcare, most of the data was on paper, all in filing cabinets, and it basically created an in-person experience when you talk to your doctor. He only had whatever data that he has on the latest write-up. Whereas now, with everything being easily accessible through electronic medical records, you could actually make changes to your patient record right as you're telling him what it is that you're having issues with, and kind of input that right in the patient record. It also allows for flexible data sharing with on-premise or HIPAA-compliant share file solutions. So this allows for users to share, or doctors to share, patient files with nurses securely, instead of having the data on the device. It all comes from an on-premise share file solution or share file in the cloud. Citrix Ready opportunities in this space would be technology that enable mobility initiatives. So you're talking about tablet devices, dictation devices, or software, or actually even also endpoint solutions like mobility solutions. From the IT efficiency and flexibility side of it, these are allowing IT to still be pretty efficient when it comes to the rapid changing environment in healthcare. As I was saying, there's a lot of mergers going on in IT consolidation, as well as health systems that operate in multiple locations and multiple care facilities, and IT has to sort of manage that from a central location. Some of the tools that we're allowing and providing with IT of healthcare organizations is, like provisioning server, which allows for a single image management across physical and virtual environments, faster and automated image update capabilities. You can streamline patching with rollback. You can reduce application sprawl with XenApp and AppDNA. You could, some of the benefits that this sort of segment gets is, you could reduce expensive storage and infrastructure costs with XenApp, lower endpoint device costs via inexpensive and secure HDX thin clients. You can get better OpEx with AppDNA for application remediation and patch management. And, you can create sort of a hybrid cloud model that allows for an on-prem for your key critical applications, but you could offload a lot of the admin IT tasks off into the cloud. Citrix Ready opportunities in this space would be enabling technologies to allow admins to manage large-scale deployments without additional overhead. So some of the key things I could think of is like IT management type tools, proactive management, and basically anything that allows IT to manage without having organizations to manage IT sprawl without having to increase overhead or CapEx.
This is the Get Started page. We have 3 simple steps that the partner needs to follow. The step 1 is to sign up at our registration page, a link that I'll be sharing in a minute. The step 2 would be to qualify your submission, basically provide us admin help us qualify your product as much as possible. We'll of course work on one-on-one basis after you sign up. But basically, any detail that you could provide that helps us align you to one or many industry verticals, we'll go ahead and do that. And last step is to run the joint promotions with us, which is basically we are giving away 4 benefits. Basically, the white paper. We are offering joint white paper that showcases Citrix integration in an exclusive landing page. Apart from that, we have lead gen webinar, a podcast, and also sales reference card that we are introducing new as part of this initiative. We will talk in more detail on one-on-one conversations. I will very quickly go to the sign up page for you guys to sign up immediately. So the deadline for sign up is at April 7th, 2017. That's about 20 days from now. bit.ly/CR verticals, capital CR and small verticals, and I'll share this slide deck with you guys as soon as possible. And for further questions and answers, I'm sorry that we couldn't attend it today. In this webinar, you can drop it at Citrix Ready at citrix.com or email directly to me at sagni.citrix.com. So I want to take time to thank our speakers, Yuting, Nathan, and Corinne, for taking the time and sharing the industry experience. Thanks for that fantastic presentation. And lastly, I would like to thank each one of you for staying back, attending our webinar today, and I look forward to receive your sign-up requests and collaborate you further. Thank you so much.